Vision to create awareness amongst people and to protect our social heritage and to let people make their own decisions. Here we invite experts to discuss and explore diverse opinions, different perspectives, various issues, problems, and their solutions on various fields, including art and culture, healthcare, environment, education, and many more. Each webinar is an interactive session with a deeper understanding of the topic at hand. If you miss any part of the session or would like to go through the previous sessions, kindly visit our website, vishwa.org or Vishwa Talks YouTube channel for a full library of past Vishwa Talks on various interesting topics. Every expert has a journey, and today's speaker is someone whose journey has been guided by a passion for helping people live healthier lives through physiotherapy, research, and innovation. Dr. Natasha Verma is an assistant professor in the Department of Physiotherapy at Garden City University, Bengaluru, and a PhD scholar. She completed a master's in respiratory, respiratory physiotherapy from MS Ramaya Medical College and graduated with top academic honors in her bachelor's degree. Her clinical experience at Apollo Hospital has given her valuable insights into patient care, especially in the field of cardiorespiratory rehabilitation. Beyond clinical practice, Dr. Verma is an accomplished researcher with several publications in national and international journals. Her work spans cardiorespiratory rehabilitation, chronic diseases, women's health, and digital innovations in health. She has also contributed to academic books and holds multiple patents for innovative healthcare technologies designed to improve patient outcomes. Her, dedica- Her dedication to research and innovation has earned her several Best Paper awards at national and international conferences, reflecting her commitment to advancing evidence-based healthcare. Today, she joins us to speak on a topic that concerns us all about our heart health. Please join me in warmly welcoming Dr. Natasha Verma to share her insights on silent killers of heart. Know the signs, protect your heart. A very good morning, ma'am.
A very good morning. Shall we start?
Welcome to Vishal, ma'am. Yes, please.
Yeah. Good morning, everyone. First of all, I would like to extend my sincere gratitude to Vishwa Talks for giving me this wonderful opportunity to speak today and contribute to spreading awareness about heart health. It is an honor to be a part of this initiative that educates people on such an important topic. Now, heart disease remains one of the leading causes of illness and death worldwide. And the concerning part is that many of the factors that increases the risk of heart disease are preventable. Through awareness, early detection, and simple lifestyle changes, we can significantly reduces this risk and lead healthier lives. Today's webinar is titled "Silent Killers of the Heart," which or where we will discuss the major risk factors that often go unnoticed, such as high BP, diabetes mellitus, high cholesterol, smoking, obesity, physical inactivity, stress, and unhealthy dietary habit. We will also talk about the practical steps that each of us can take to protect our heart and improve our overall well being. And my today's goal is not only to share medical information, but also to encourage everyone to adopt small, sustainable lifestyle changes that can make a very big difference in preventing heart diseases. Once again, I sincerely thank Vishwa Talks for this opportunity and thank all of you for taking your time to join this session. I hope you find it informative, engaging, and useful. Okay, so as I said, the today's topic is silent killers of the heart. Know the signs. It is called as a silent killer because it often develops without obvious symptoms until a serious event like a heart attack occurs. By the end of this session, you will understand how heart disease develops, who is at a risk, how to recognize the warning signs, and most importantly, how to prevent it. Next slide, please. Now, first slide is what is heart? Now, everybody knows that yes, there's a part in our body which is an integral organ which helps in promoting and doing all the activities. So, I have to tell you, our heart is one of the hardest working muscles in our body. Now, if you're thinking that heart is only an organ, no, heart has also got some muscles which is the hardest one. I mean, they work continuously 24 by 7. It beats continuously throughout our life, pumping nearly 4 to 5 liters of blood every minute whenever we are resting. Now, if I'm talking, it doesn't mean that my heart is not pumping. It is pumping continuously so that our other organs of our body can receive blood. The blood which is the blood carries, I mean, the blood which is originating from the heart, it's carrying oxygen, nutrients to every organ. And interestingly, the heart also needs its own blood supply through the coronary arteries. And if this arteries becomes blocked, the heart itself begins to suffer. Next slide, please. Now, now, if you can see, there's a very big word which is written in the slide. It is called as atherosclerosis, and which is causing a very major heart disease, which is called as coronary artery disease. Now, over time, fat, cholesterol, and other substances which we are taking in our day to day life accumulate inside the artery walls. Now, what is artery? If you remember the first slide, arteries, coronary arteries are the arteries, or I'll say that it is a pathway which carries blood to the heart. Now imagine the artery, I mean, just think it is a pipe kind of thing. If there are things which are accumulated, now obviously it will be jammed, right? So similar things happens in the heart as well. So over time, the food items which we are taking, which contains fat, cholesterol, and other intoxic substances, gets accumulated inside the artery walls, forming plaques, and this process is called as atherosclerosis. Now what will happen? As this plaque builds up, the arteries becomes narrow down. I mean, if you understand, the artery size is this, because of the deposition of the other intoxic materials, it becomes very narrow down. Now, if it is becoming narrow down, what is the result? It will reduce the blood flow to the heart. And when this affects to the coronary arteries, it will be called as coronary artery disease or CAD. Now, if blood flow becomes severely restricted or completely blocked, it can result in a heart attack. Pratyusha ma'am, next slide, please. Okay, now we have a myth that fat deposits occur only at the old age. Many people believe that heart disease only starts in the old age, but that's actually a myth. Now, if you see, there are young people who are having cardiac arrest and they are dying. So, research has shown that fatty streaks or the intoxic substances in arteries can begin as early as childhood, even around 2 years of age. That's why nowadays the dietary habits of the baby is also being changed. I mean, if you compare to the older times. Now, this disease progresses slowly over decades before the signs and symptoms appear, and this is why healthy habits should start early in the life. Ma'am, next slide, please. Okay. Now, it's not only the heart which is getting affected with this intoxic substances. Atherosclerosis, which I have just explained, it doesn't only affect the heart. It can also reduce blood flow to the brain, leading to stroke, which is again a very common condition which is affecting most of the people. It can also affect the blood supplies in the legs, causing peripheral vascular diseases like varicose veins, DVT. So, heart disease is actually a disease of the entire blood system. If you're thinking that no, if I am eating something, it is only going to affect my heart, it is absolutely wrong and it is a myth. It's not only going to affect heart, obviously, heart is a major organ, but the other organs are also affected and cause many life threatening conditions. Next slide, please. Okay. So whenever this fatty deposits and all these things are accumulated, the heart disease, I mean, the heart will look like this. If you can see the image, how bad the heart looks, and this suffocates the whole body, and it will be called as a silent killer. Next slide, please. Okay. Now, coming to the sign and symptoms, now how we will identify that yes, it is CAD, coronary artery disease. One of the major and the biggest challenge is that many people doesn't have symptoms for years. I mean, yes, there are fat depositions which are happening inside the arteries, but the sign and symptoms might not arise in the early time. So, when symptoms do appear, they may include chest pain or pressure during the activity. Whenever you are doing any kind of physical activity, you will feel a slight pressure. It might not be a pain, but you will feel a pressure, like whenever you're climbing stairs, whenever you're walking, you will find a slight discomfort. Now, second sign and symptom which is most important is pain radiating to the arm, jaw, neck, or back. Now, I guess everybody is very much aware that if the left side, left hand, arm, jaw, neck, or back, if it is paining, it might be a heart, CAD. So please understand. Now, many of the time it is said that heart is in the left side, right, or right side. I mean, many people say left side, right side, but actually the heart is in the center. Okay, so you might feel pain here, and many of the people understand that it's gastritis, and they get confused between heart attack and gastritis. So please understand there might be a pain, chest pain, or pressure in the middle, and the pain can radiate towards the left side, mostly in the arms, jaw, neck, or back. Now, third sign and symptom will be there can be shortness of breath, you can feel breathlessness, there might be sweating, and there can be nausea. Now, what is nausea? You'll have a tendency to vomit, but vomit will not come back. I mean, a vomit will not happen. Okay, you will just have a tendency that, oh, I have to vomit. And that is why people get confused in gastritis, because in gastritis also people have the tendency that, oh, they'll have a feeling that they want to vomit, but vomiting is not happening, and which is called as nausea. So ignoring this sign and symptoms can lead to heart attack or even sudden cardiac death. Next slide, please. Okay, now how big is this problem, correct? Heart disease remains the number one cause of death globally. Although developed countries have reduced death through awareness and prevention, countries like India continue to see increasing number of cases due to lifestyle changes, urbanization, diabetes mellitus, hypertension, and stress. Next slide, please. Okay, now as deaths are happening, it's a burden for our country, isn't it? So, this slide highlights the enormous burden of cardiovascular diseases. Beyond affecting health, it impacts families emotionally, financially, and places a huge burden on healthcare system. This is why prevention is much more effective than the treatment. Now, if you can see my slide, it's not only a cardiovascular health or heart attack which is affecting the people. There are many other conditions which are acting as a burden in our country. Now, if you can see stroke, if you can see lung cancer, if you can see breast cancer, if you can see other diseases, it's affecting India like anything. This was a survey, I mean, this is a picture which I have taken from a survey from 2021, and it is acting as a burden for our country and the healthcare system, correct? Next slide, please. Okay. Now, why? I should be worried. Why should Indians be worried, right? Because we are living in a country where food is very important. All the foods are made in ghee, all the foods are made in oil. So, yes, Indians should be worried because studies shows that Indians develop heart disease at a very young age compared to many other populations. Even with lower cholesterol levels, Indians have a higher risk because of genetics, diabetes mellitus, abdominal obesity, and lifestyle factors. And this makes early screening especially important. I mean, if you are having, I mean, we are going to discuss the risk factors in the furthermore slides, but yes, as Indians, we should be worried because the statistics are showing that at a very young age, people are getting cardiac arrest. Might be because of their diet, might be because of their lifestyle, urbanization. There are many factors which are causing this kind of conditions in people. Correct? Next slide, please. Okay, now this slide is why me, why I can get, or why I mean, am I at a high risk of getting a cardiac arrest or a cardiovascular disease? Yes, because there are some risk factors which are modifiable. I can modify it, which are non-modifiable. Correct? So heart disease doesn't happen because of one single reason. Some factors like genetics, I cannot modify my genetics, right? If I have a history that my father, my grandfather, my mother, my grandmother, or my paternal grandfather or grandmother had cardiac arrest, then yes, I am at a risk that I might also get heart conditions, right? So some factors like genetics, age, I cannot change. I mean, yes, because of this, I will be at a high risk. Now, however, lifestyle choices like including unhealthy diet, lack of exercises, obesity, diabetes mellitus, hypertension, stress, and smoking, which is a greatly increase the risk of having cardiac arrest. Now, the good news is that many of this are completely under our control, which we can modify, right? So, in the further slides, we are going to discuss that. Next slide, please. Okay, now as I was talking about the risk factors, in my left hand side, you will see the non-modifiable risk factors where I cannot change it. The first group, which is on the left side, if you all can see my screen, the first group includes the things we cannot change, like age. Now, obviously, we know at a age, the physiological changes will happen in our body. And at a certain age, the heart will develop all these conditions. Gender is again a very important factor. There are studies showing that men have higher rate of having cardiac arrest. If you have a family history of cardiac arrest, then yes, you cannot change. And ethnicity. Now, what is ethnicity? Ethnicity means from which population or from which country I do belong from. Indian, Africans, Europeans, Asians, right? So it plays a very major role. Now, if you see my right hand side, the second group, which includes the factors which we can control, like cholesterol, yes, it is under our control. Blood pressure, it is under our control. Diabetes mellitus, smoking, obesity, alcohol intake, and physical inactivity. So our focus should not be on the non-modifiable factors which are on the left side of my slide, but our focus should be on the right side risk factors which we can control and which are the modifiable risk factors. Pratyusha, next slide, please. Okay, now cholesterol. Everybody knows about cholesterol, right? But do you know that there are some bad cholesterol and good cholesterol which our body takes? Now, let's discuss what is cholesterol and how it is uh, destroying our body. So, I will not deny that cholesterol is not an essential part of our body. Yes, cholesterol is an essential part of our body because we require some amount of cholesterol in our body. But the problem arises when this cholesterol levels becomes too high. Now, excessive cholesterol, what will happen if I'm taking too much of oily foods? Now, this excess cholesterol gets deposited in the coronary arteries, which gradually blocks the blood flow. Unfortunately, the high cholesterols usually have no symptoms until the complications develop. I mean, suppose I'm taking too much of junk foods, I'm taking oily foods, my cholesterol is rising, but my body is not going to show me any sign of symptom. Now, if you remember, I told you some sign of symptoms of heart disease like pain in my chest, shortness of breath, nausea, sweating. But when we have high cholesterol levels in our body, I will not get any sign and symptom. At a very later stage of time, some people will develop white patches around, I mean, on the topmost of the eyes. That is one of the salient feature of having high cholesterol. But other than that, you might not get many signs and symptoms telling you that yes, you have high cholesterol. Next slide, please. Okay, now the major question is, where does this cholesterol comes from, right? I mean, yes, one thing is our food item. So cholesterol comes from two sources basically. One is the food which we eat, especially the animal products like meat, eggs, butter, and dairy. And the second source is our own liver, which naturally produces cholesterol. That's why both diet and lifestyle matters a lot. Now, I can modify my dietary habits, right? But I cannot tell my liver that you don't produce more cholesterol. The liver is naturally producing the cholesterol, which again, non modifiable. I cannot modify my liver. I can only modify my diet, where I can understand that okay, I am not taking this junk food, I am not taking oily foods, right? So I can reduce the level of cholesterol in our body. Next slide, please. As I was telling, there is good cholesterol, there is bad cholesterol, right? So the bad cholesterol is called as LDL. Now, the full form of LDL is low density lipoprotein. Low density lipoprotein is known as the bad cholesterol. Now, what it does, it carries the cholesterol into the artery walls, forming the plaques. Now, second is HDL, high density lipoprotein, which is called as a good cholesterol. Now, don't think that it is showing high means it is bad. It's just the opposite in terms of cholesterol. If you have low density lipoprotein, then it is bad cholesterol. If you have high density lipoprotein, that means you are having good cholesterol. Now, what does this good cholesterol does? It helps in removing the excess cholesterol from the bloodstream and transports it back to the liver, which is very good for our body, right? Suppose I am eating junk food, I'm taking oily foods, or my dietary habits, it's very bad. If you have high density lipoprotein, it will actually try to remove the excess cholesterol which is there in your body, and it will transport it back to the liver, so that liver can naturally generate high density lipoprotein, which will be considered as the good cholesterol for our body. Next slide, please. Okay, obesity, right? What is obesity? Obesity is the extra fat accumulation in our body, correct? So obesity is defined as the extra fat accumulation in our body, and being overweight significantly increases the risk of heart disease. So one useful measure is waist to hip ratio. So what you can do, you can take a inch tape, you can measure your waist. So your measurement site should be, the inch tape should come around your umbilicus, and if you feel your body, there is a bony prominent around your hip joint, right? You have two prominent around the left and right side. If you can palpate that, if you can touch it, you will feel a hard surface, right? Hard bone around your hip joint. So you have to take measurements of both, and you have to divide it, and then you will get a hip waist to hip ratio, which will term that you are obese or not. So excess fat around the abdomen is particularly dangerous because it increases inflammation, which is infection, and insulin resistance, which will cause diabetes mellitus. Next slide, please. Yeah. So if you can see pears and apples, right? So if you see, there are two kinds of people. Okay, there is one population who have fat accumulation in their abdomen only, but there is one population who has fat accumulation in their hip joint, hips, and in the thighs. So, not all body fat is actually equally harmful. So, if you can see, I have mentioned pear shaped body and apple shaped body. Now, please imagine the pear, how a pear, a fruit looks like, and how does an apple look like. So, a pear shaped body stores fat mainly around the hips and the thighs, and the apple shaped body stores fat around the abdomen and the surrounding internal organs of the abdomen. And abdominal fat is associated with much higher risk of heart disease and diabetes. So a apple shaped body is more harmful compared to a pear shaped body. So if somebody has a pear shaped body, yes, it is, I am not saying that it is good, but it is better than an apple shaped body. So if you are seeing any individual who has fat accumulation in and around the abdomen, please go to a dietitian, please go to a physiotherapist so that you can start your exercises and reduce the fat. Okay, gone are the days when people used to say that I am from a very healthy and wealthy family, that's why my tummy is coming out, right? Nowadays everybody wants a flat tummy because there are many conditions and many life threatening conditions which are happening because of this fat accumulation. Next slide, please. Okay, now this is a slide which is called as BMI, Body Mass Index. Now I have portrayed it very clearly so that everybody can understand and everybody can calculate their BMI. If you have a pen and paper or a a mobile phone in your hand, please calculate your BMI and check if you're falling under the correct criteria or not. Now the formula is very easy. So you have to write your weight and divide your height in meters. Okay, so you have to divide the weight in meters in square. So you have to write your height twice and then you have to get the score. Now if your BMI, now if you can see the screen, right, if you can see the screen, if your BMI falls under 18.5 to 24.9, then you are okay, your BMI is okay. Now if your BMI is coming more than 25, I mean if it is coming in the range between 25 to 29.9, then you are obese, or I'll say you are overweight, right? Now if your BMI comes under the range of 30 to 34.9, then you are, or you will be called as obese. Now if your BMI is coming more than 35, then you are extremely obese, you have to go and show it to a doctor. Now, the last criteria is if your BMI is coming less than 18.5, then you are underweight. Now, for that, you have to modify your lifestyle. You have to take good amount of intake so that your BMI comes into normal. So, from this slide, you can understand that you have to be in the range of normal. You cannot go into overweight. You cannot go into underweight. You obviously you cannot go into obese and extremely obese, that is very bad. So please try to maintain your BMI into normal. Now please remember this formula: BMI is equal to weight in kgs divided by height in meters per square. Okay, please remember, if you have not calculated your BMI, you can do it later. You can take a screenshot of this, know your BMI. Nowadays, if you just write in Google BMI calculator, there are many apps for it. You can just type your weight and height there, and it will calculate your BMI, and they will also tell you under which range you are falling into. Okay, next slide, please. Okay, so this is a cartoon, right? I have put some cartoons so that we can understand this physical inactivity. Now, first cartoon shows that he or she is sleeping, and then she has woken up. He has woken up with a cup of coffee, right? I mean, this is our daily routine. We woke up, we go to our daily activities, and then we'll be holding a cup of tea or a black coffee, correct? So every morning, my brain tells me to do exercise, but my body laughs at my idea, right? I guess this is the scenario for most of the people, if I am not wrong, right? So, but we have to change this habit. You cannot lead your life with this physical inactivity. Modern lifestyles involve long hours of sitting nowadays, be it IT professionals, be it professors, be it anyone. be it anyone, the lifestyle has become very sedentary. There's laptop work, there's lot of work which is long hours of sitting, right? And because of that, our physical activity has been decreasing. So physical inactivity increases the risk of obesity, diabetes mellitus, hypertension, and heart disease. Even simple activities like walking can make a very huge difference. That's why whenever you go to a doctor, they'll say that you just walk for 30 minutes, right? They just give this advice. And nowadays, I'll not say that people are not aware. People are very much aware about their heart, and not about heart only, about the overall performance of their body, and they are going for morning walks, evening walks, jogging. There are many people who are doing physical activity, but yes, there is a certain population who is actually inactive with physical performance. So there's high requirement of doing physical activity, because it can arise many life threatening conditions or many serious conditions. Next slide, please. Okay, now if you can see this slide, physical activity for adults and older adults. Now we have guidelines, and they say that for a week, I mean, I'll not say all the 7 days, but for 6 days in a week, you should do physical activity of 150 minutes per week. So if you can say 30 minutes in a day, correct? Okay, if you say 5 days in a week also, you should do a physical activity of 30 minutes in a day. Now what this physical activity will help in? It will help the overall growth of the health, it will improve your sleep, it will maintain the healthy weight, it will manage the stress which will cause joint and back pain, and at last it will improve the quality of life of yours. So some is good, more is better. Make a start today. It's never too late, and every minute does count. Now if you exercise, there can be reduction of type 2 diabetes mellitus, there is a reduction of cardiovascular diseases, there's a reduction of falls, depression, etc. And there are high chances that your pain, I mean, every adult is like, I have knee pain, I have back pain. With physical activity, all these problems will be reduced. Next slide, please. Okay, now this slide is about the exercises which I have told. Now, as I said, 150 of moderate intensity aerobic exercise. Now, what is aerobic exercise? Aerobic exercise are the exercise which requires oxygen, right? So, for example, swimming, walking, cycling, treadmill walking. If somebody wants to dance, please go ahead. So, aerobic exercise needs to be done 30 minutes in a day. If you're not able to do 30 minutes, start with 10 minutes, then progress. 10, 12, 15. I am not saying that you have to walk half an hour. Don't take rest. Just walk, just walk. Nobody is telling you that. But it is very important to take rests in between, because we don't know your stamina. So it is very much required to consult a physiotherapist, so that they can make a tailor-made prescription for your own health, and you can do exercises. Now with this, walking, doing cycling, doing swimming is not enough for your body. You have to do muscle strengthening exercises also. Now why muscle strengthening and resistance exercises are important? Because howsoever, our body's strength, our body's resistance has become very low nowadays. So it is required that at least 2 days in a week you should try lifting some weights. Now again, that depends on your muscle. So please don't try at home. Please don't just think that I will try with 1 kg of dumbbell or 3 kg of dumbbell and I'll start exercising. Please don't do that, because physiotherapist supervision is very much required, because they will do a proper assessment. They will assess you, they will understand your how's your muscle strength, if you had any other problems prior. So please don't start the exercises your own, because nowadays in Facebook, in YouTube, in Instagram, there are so many vloggers and influencers who are promoting exercises. But please do a one-on-one consultation with a physiotherapist so that they can make a tailor-made prescription, exercise prescription for you according to your body and the exercises which suits you well. Correct? Next slide, please, Pratyusha. Okay. Now coming to cigarette smoking. Now everybody knows, right? Cigarette smoking is one of the worst habit, which are young adults, which many of the people are having, right? So smoking is one of the biggest risk factors for heart disease. Every cigarette contains thousands of harmful chemicals that enter the bloodstream and damages the inner lining of the blood vessels. Now, this damage causes the blood vessels to become narrow down. I was telling you about, right? Narrow, broad. So, cigarette smoking, as cigarette contains lots of harmful and intoxic chemicals, what it will do, it will try to become the blood, it will make the blood vessels very narrow down, so it will become less flexible and it will make it harder for blood to flow to the heart. Now, smoking also raises blood pressure, reduces the level of good cholesterol, which we have just discussed, high density lipoprotein, and it increases the tendency of blood to clot. Now, this changes significantly increases the risk of heart attacks, stroke, and other cardiovascular diseases. The encouraging news is that the body begins to recover soon after quitting smoking. Blood pressure starts to improve, circulation gets better, and the risk of heart disease gradually decreases. And that's why the best time to quit smoking is today. Right? Pratyusha, next slide, please. Okay. Cigarette smoking, as I said, if you are not consuming a cigarette, actually a cigarette is consuming you, because as I have told you, this intoxic chemicals are getting deposited in the body. It's not only the heart which is getting affected, it's your lungs also which is getting affected, and the chances of getting COPD, chronic obstructive pulmonary disease, getting any kind of respiratory disease are very common. Even lung cancer has become very common for smoking. So, this is the best time to quit smoking. Next slide, please. Okay, coming to the next most important topic, alcohol consumption. There is a common belief that drinking alcohol is good for the heart. However, this is often misunderstood. While some studies have suggested that possible benefits are actually there if an individual consume small amounts of certain alcoholic beverages, alcohol should not be considered. I mean, according to me, alcohol should not be considered as a treatment or a preventive measures for heart disease, and no healthcare professionals, I mean, howsoever research has been done, howsoever people are saying that if you have kidney stones, please drink beer, it will try to remove it. Please don't do any type of practices, please don't practice any type of beliefs like this. If you have any problem, please go to the doctor, take proper medication. Please don't take alcohol as your medication. Excessive alcohol consumption can actually increase your blood pressure and unnecessary calories, which can lead to weight gain, damages your liver, and it also increases the risk of irregular heart rhythms and other cardiovascular problems. And it can also interfere in the medications which you are taking, and it also worsens the existing health problems which you are having. So the key message is, don't take alcohol. For people who are already drinking alcohol, it should be stopped. And for those who are not drinking, there is no health reason to start drinking for health protection. So I just want to give a take home message: avoid smoking and alcohol completely. This simple lifestyle choices can sorry significantly reduces your risk of heart disease and improves your overall health. Next slide, please. Okay, coming to the most, again, one of the most important condition, diabetes. Now, diabetes mellitus, right? The complete name is diabetes. I mean, we often call it as diabetes, but the complete name of this condition is diabetes mellitus, correct? So, diabetes mellitus is a chronic metabolic disorder in which the body is unable to maintain the normal blood sugar levels, right? We all know diabetes happen because our body is not able to maintain the sugar levels. Now, why this happens? This happens either, I mean, it's only about the food which we are taking? No. Correct? I mean, if I'm taking too much of sugar, yes, I'm at a risk of developing diabetes mellitus, but this is not only the reason. Now, this happens either because of the pancreas. Pancreas is an organ of our body. Pancreas doesn't produce enough insulin, or our body cells are not able to respond effectively to the insulin, correct, which our pancreas is producing. So insulin is in a hormone that helps the glucose enter the cells to be used for energy. So we cannot stop insulin, we cannot stop sugar completely, but it has to take in moderation. Now, diabetes mellitus is one of the strongest risk factor for cardiovascular diseases. Persistently high blood sugar damages the inner lining of the blood vessels, making them more narrow and stiff. It also accelerates the buildup of the fatty deposits known as atherosclerosis, which we have discussed already, increasing the risk of heart attack, stroke, and peripheral artery diseases. People with diabetes often have conditions like high BP, abnormal cholesterol levels, obesity, which can further increases the risk of heart disease. So if blood sugar is not well controlled over time, cardiovascular complications become much more likely. Now, if you go into depth of diabetes mellitus, there are many types of diabetes mellitus. There is first one which is called as type 1 diabetes mellitus, which is an autoimmune destruction of the immune producing beta cells of the pancreas. So the body itself is not producing enough insulin, which is required for the energy. Right now, the commonest is type 2 diabetes mellitus, which is very common in our society, very common in Indian population. Right, 90 to 95% of diabetes cases are type 2 diabetes mellitus. So, if what happens in this, our body becomes very resistant over time, so insulin production may also decrease. So commonly associated with obesity, physical inactivity, like that. And the third one is gestational diabetes mellitus, the diabetes mellitus which pregnant women develops during pregnancy, right? Usually it relieves or resolves after the delivery, but it also increases the mother's future risk of developing type 2 diabetes, and it also increases the risk of developing diabetes, type 1 diabetes mellitus for the baby. Correct? um, and there are other specific types also, like there are endocrine disorders, there is some drugs which has been taken which can cause drug induced diabetes mellitus also, right? So for this you have to go for fasting blood sugar, random blood sugar. But nowadays doctors are not only relying on fasting blood sugar and random blood sugar, they are relying on an important investigation which is called as HB1AC. HB1AC, okay, which reflects your blood sugar, average blood sugar levels for over the previous 2 to 3 months. Now, what is the normal? Normal should be less than 5 to 5.7%. If you are coming into a range of 5.7 to 6.4%, then you are pre-diabetic. And if your range goes beyond 6.5%, then you are diabetic. Okay, so this is a small understanding about diabetes mellitus. Pratyusha, can you please change your slide? Yes. So yes, there's an interaction of risk factors which is happening. There is no clear-cut line about blood pressure, cholesterol, overweight, smoking. There are many risk factors which are becoming clustered and uh, giving heart diseases, and majority of the events arises in individuals with modest elevation of many risk factors. Now, it is not only one risk factor which can cause, there are risk factors which are combining as a cluster in our body and giving cardiovascular diseases. Next slide, please. So this was one of the proverb which I came across. Misfortunes always come in by a door that has been left open for them, right? So very relatable to the heart disease. That's why I have just put it. Next slide, please. Yeah. So every day you make choices to try to protect yourself and your family. In fact, protecting yourself has become second nature. You should do it, but do you know how you can protect yourself? I mean, I have just told you these are the conditions which can give, but how to? How to reduce all that? How do I reduce the causes of heart disease is a very important learning objective which we are going to cover now. Next slide, please. Okay. Yes. So this was again one of the most important thing which I came across. So every individual, right? I've just given an example of car. If I want to buy something, I want the best thing, right? If I want to buy a fridge, I want the best fridge which comes in my range. I want the best AC. I want the best car. For me, I want the best dress, right? For everything, I want the best thing, correct? But for my own body, I follow advices. I mean, I follow advices which are there in YouTube, which are there in Facebook. There are many influencers which are talking about it, right? We take advices from the friends, but but going to a doctor, going to a physiotherapist is one of the best thing which you can do. Now, creative strategies do not actually work, right? If you are saying that I never had a test, I will not go to a doctor, I will take my own medications because he or she was taking this medication. I will not see any doctor. I am my own doctor. I know everything. This creative strategies actually doesn't work nowadays. You have to go to a healthcare professional to get a check on yourself, right? Next slide, please. Okay. Now, preventing heart diseases, there are few rules which you have to understand, correct? So, the first the first thing is look before you eat. What are you eating? A heart healthy diets include plenty of fruits and vegetables, whole grains, lean proteins, low fat dairy, less salt, less sugar, less saturated and trans fats. Healthy oils such as mustard, olive, sunflower, soya bean, and groundnut oil are better choices. Avoid processed foods, avoid fried foods, avoid excessive oily foods in your diet. This is the rule number one which you can bring in your from your own house. Next slide, please. Okay, I have already explained you about this. Next slide. This also I have told you. Please try to limit food which are rich in cholesterol and saturated fats. Try to avoid much of yolk, egg yolk, fatty meat and organ meat which is liver, butter chicken, milk fat like desi ghee. Again, desi, there are many people who say that desi ghee is not bad for our body, but taking excessive desi ghee is also not very good. Butter, cheese, malai, rabri, these are some of the dishes which needs to be avoided. Hidden fat like bakery biscuits, patties, cakes, pastries needs to be avoided. Next slide, please. Okay, so cooking oils, there's a mystery of PUFA and MUFA. So saturated fats, right? We have different types of fats also in diet. So saturated fats increases cholesterol. So avoid taking vanaspati ghee, palm oil, coconut oil. Try to take monosaturated fats, which are healthy for your body, like olive oil, groundnut oil, canola oil, mustard oil. You can also take polyunsaturated fats, which are sunflower oil, soybean oil, or you can take omega-3 fatty acids, fish oil. All that things are heart healthy. You can take all these things. Next slide, please. Next slide, please. Yes. Rule number two is preventing your heart disease, right? Exercise. I have spoken everything about exercise. You have to maintain a level of physical activity of 150 minutes per week, which will keep you fit, and it will also matches your calories which you are taking. several functions in preventing and treating those at high risk. You can reduce obesity, it will increase HDL, it will lowers down your low density lipoprotein, and exercise will also help in controlling diabetes and hypertension. Next slide, please. Okay, so this was again one cartoon which I have seen, and I was talking about 150 minutes of exercise. So, moderate to intense physical activity for 30 to 45 minutes day on most of the days of the week is recommended. Please do a physical activity, meet a physiotherapist, they'll make you a exercise protocol which you can follow every day and meet your bodily requirement. Next slide, please. Okay, walking for a healthy heart. As I said, aerobic exercise is one of the most important thing which you have to do. So, complicated exercise machines and going to gym is not very essential. I mean, if many people say that they're going to gym, they're lifting heavy weights, but it might not be a very good thing for your healthy heart, because a physio will give you exercises or will make your exercise prescription in such a way which will meet your daily requirements of your activities of daily living. They will check your strength, they will check your range, they'll check the power of the muscle, they'll check if there are any other comorbidities which you are having, and then make your exercise prescription. So just one advice from my side: just walk, just do a brisk walking. If you're not able to find 10 minutes of your time, time of yourself in a day, it's waste, right? So at least try to walk for 10 minutes. If you are not able to, take rest after doing 5 minutes. And I am not saying that you have to walk very fast, just do a brisk walking. Walk very slow. It's I am not telling that you have to walk very fast, you have to swing your hand, then only it's called as exercise, or then only it's called as good for health. Just do brisk walking so that you can understand and you can feel the change in your body. Next slide, please. Okay, rule number 3: stop smoking. If you're smoking, please stop smoking right now. Don't encourage all these habits, because we know how bad it is for our body. Next slide, please. Okay, so benefits much beyond the heart disease. This will, whatever exercise, smoking, all this, whatever I am telling, diet, it will not only help your heart disease, but it will also give benefit for cancer, diabetes mellitus, chronic respiratory diseases, osteoporosis, which is weakening of your bones, oral health, and mental health. So this the advices which I have given is not only for a healthy heart. You can implement all these advices for other life threatening conditions also. Next slide, please. Okay. Rule number 4 is know your number. Know your number in the sense, not your mobile number, not your flat number. It is about the investigations. Know how much is your total cholesterol. You should have an idea about your LDL. You should know an idea about HDL. You should know an idea about triglycerides. You should know your diabetes number. You should know how much is your BP. All these numbers are very important. At least cholesterol, diabetes, and BP. You should know what is your BP. Please go every week. There are many centers where, at least for BP, you can buy, if any elderly is at your home, please buy a sphygmomanometer, a digital BP machine, where you can just keep the cuff around your forearm and you can press the button. It will give you the heart rate and BP. It is always advisable, if you have not only, I'm not telling only about older people. Nowadays everyone should keep a digital BP machine and a pulse oximeter, so that you should know how much is your oxygen level, how much is your heart rate, and how much is your BP, right? So I'll not say go every week and do it. At least 3 months in a 3 months you can do a checkup, regular checkup, so that you know your numbers of your heart health. Next slide, please. Okay. Now, as I said, Benefits, yes, if you do exercise, there will be 10% reduction in cholesterol. It can produce 20 to 30% decline in cardiovascular health deaths also. Correct? Next slide, please. So controlling your blood pressure is very important. Blood pressure, we define it as high blood pressure and low blood pressure. Both are bad for our body. So high blood pressure is called as hypertension, where low blood pressure is called as hypotension. So adults should have their blood pressure checked it's written 2 years, but it's always good to check your BP if you don't have any sign and symptoms. Optimal level is 120 by 80, but nowadays the guideline says it's 130 by 90, because seeing the urbanization and the physical activity nowadays everybody are having. So if your BP is high, please modify your diet, take less salt. Now I want to ask, why everyone says that if you have BP you should take less salt? What is the relation between it? So, if you take high amount of salt, your kidneys will be at fault. Now, if your kidneys is at fault, it will give or it will generate more pressure to the heart. And if it generates more pressure to the heart, your BP will increase. That's why they say that you should take less amount of salt in your food. And obviously exercise, please adhere to the prescribed medications which doctors are giving without fail to decrease the chances of getting high BP, because high BP can give you cardiac arrest, it can give you stroke also. So it is very much important to control your BP. Next slide, please. Okay, control your blood sugar. I have already told you what are the numbers of HB1AC, FBS, and RBS. So if your blood sugars are high, please go ahead with diet. Please go ahead with your weight reduction, exercise. Again, adhere to the prescribed medications without fail. Don't miss your medications. If your sugars are very high, then doctors will give you insulin. Please take all that medications on time, because if you are not adhering to the timeline, it will again give you some life-threatening conditions. Next slide, please. Okay. Now, if in your family, if somebody has diagnosed with heart disease, don't lose hope. If you're already a heart disease, I mean, I don't know in this group of people is anybody a heart patient or not, but if you already have a heart disease, don't lose hope. Modern medications, the healthcare has advanced tremendously. By taking medications regularly, by exercising, eating healthy, quitting smoking, and attending regular follow ups, you can live a long and an active life. So don't lose hope. Next slide, please. Okay. Pratyusha, can you please click on this link, please? So 2018, Pratyusha, if you can click the link. Pratyusha, am I audible?
Yes, ma'am. Just a moment.
Yeah.
I'm opening the link.
Yes, yes, yes. Yes. So I have, this is not for everyone. This is a link. I mean, this is a calculator, like how I have shown you the BMI calculator. So in 2018, this is a calculator which has been made. Okay. So this is a tool which or where you can calculate if you are at a high risk, moderate risk, or a low risk for getting a cardiac arrest. So you have to put the gender, you have to put your age, then which race do you belong to, what is your total cholesterol. Now again, this numbers you will not know until and unless you are doing an investigation. Total cholesterol, how much is your LDL, how much is your HDL, then how much is your systolic blood pressure, is treatment for hypertension going on, if you had a history of diabetes mellitus, if you are a current smoker, or are you on an aspirin therapy. If you put down all the numbers, I mean, doctors will do that. Doctors will put down all the numbers and they will calculate if you are at a high risk, low risk, or a moderate risk. So this is a very nice calculator which has been made to assess individuals' risks of getting heart disease. Pratyusha, you can change the slide, please. Yeah. So don't wait for a heart attack to take an action. Don't wait for a second life. We are not cats, we are not animals, correct? So if you are having any sign and symptom, please go visit a doctor, please visit a physiotherapist so that we all can make your life better. We can improve your quality of life, we can improve your health. Next slide, please. Right, so this is my final message. My final message is very simple, very crisp. Whatever I have said, don't wait for a heart attack to start caring for your heart. Small lifestyle changes made today can prevent major health problems tomorrow. Remember, healthy food, regular exercise, no smoking, control of blood pressure, sugar, cholesterol, regular health checkups. Your heart works for you every second of your life. So take care of your heart, right? Next slide, please. So thank you everyone for your attention. I hope today's session was helped you in a better understanding of heart disease and inspired you to make your healthier choice. I am happy to answer any questions if you have.
Thank you so much for such a well-put-up presentation, ma'am, and thank you
Thank
for
you so
your
much.
time and patience. Uh, Before we move on to the Q&A, I'd like to take 30 seconds of everyone's time for a quick poll. This will
Sure,
help us get to know you better
sure.
and tailor future topics that we bring to you. A big thanks to everyone here today. Your presence and participation means a lot to us. While you fill out the poll, I would also like to extend my heartfelt thanks to our esteemed speaker, Dr. Natasha Verma, for sharing her valuable time and insights with us. I request all of the participants to quickly interact with the poll so that we can move on to the Q&A. While you fill out the poll, I'm quickly going to mention the upcoming talk so that the Q&A goes uninterrupted. We have Ritika Chawla, educator and environment enthusiast, speaking on 4th of July 2026, 11 a.m. onwards, on the title, Less is More, How Minimalism Can Save the Planet. Request you to register through the link that will be put up in the chat box shortly. Also, if anybody is uncomfortable coming up on video and audio, I request you to please write in your question in the chat box and I will bring it up to the speaker in time. Another 20 seconds before we close the poll. Close the poll now, moving on to the Q&A. For the question in the chat box, how can we know the future of programs conducted by Vishwa? You can visit our website, vishwa.org, wishwa.org, to know about the upcoming events and You'll get updates about all the other verticals we have. We have fundraiser programs going on. We also have educational programs going on. You can check it up on any of our social media profiles or Vishwa.org. Okay. Moving on to the first question. I'm going to unmute Mr. Shailesh Lahoti. Just a moment, sir. So kindly unmute yourself. I've prompted you to unmute.
Good morning, doctor.
Good morning, sir.
Thank you for fantastic presentation. It's very, very informative and very good.
Thank you,
Just
sir.
couple of two quick questions. See, actually, nowadays there is lot of talk about protein and all, for in diet. And in one of your slides, you mentioned to avoid, say, cheese and all. I'm talking from the perspective of a vegetarian person. So vegetarian person are having very less options. And if cheese also, they consider cheese as a protein. But in one of your slides, you written that you avoid cheese and all that. So how is like that? That is one part. And second, you talked about blood pressure, diabetes, everything, but you haven't means I think put any emphasis on autoimmune disease like say thyroid and all that. So how it will also affect the thing that I also want to understand. So these are two quick questions. Thank you.
Thank you, Shailesh sir, for your wonderful question. So, the first question which was asked about the protein foods. Sir, as a vegetarian, there are plenty of foods which are available. I will not say that the protein will only come in non-vegetarian foods. Proteins are there in vegetarian foods. Also, there are many sources of proteins which you can take, but excessive amount of protein will make your kidney worse. So, there's a condition called as proteinuria which will make your kidney very worse. So we don't prescribe more of protein in our body. So if I can explain you in a better way, so for making our body work, I mean, why we are taking food? We are taking food as a source of energy, right? So when we taking food as a form of energy, the first form is carbs, protein, and then fats. So we say that now again, carbs is also not very good. That's why we have dietitians which will make a tailor-made diet prescription for everyone, seeing your health condition. Now for a baby, suppose 2 year or a growing baby, they can take plenty of protein, they can take ghee also. But for an adult, again, for an any adult who's 30 years or 35 or 40 years even, this all, if any food is going in an excessive manner, it is going to affect your heart, sir. Okay, it's protein, be it unsaturated fat. So in my slide I have put down the good fats also, which you can take in your food. uh, Fat is, every fat is not bad for your body, so you should consider good fat, not bad fat. Coming to the second question of yours, I have put emphasis on diabetes mellitus, hypertension, obesity. I have not put much emphasis on thyroid, is because thyroid is irreversible. If I take the complete, I mean, if the diagnosis has been done on a correct time, it can be irreversible. But diabetes mellitus and all, it takes a long time to get reversed, sir. Even BP, how much ever we are seeing that exercise, all that, yes, but if you do one two mistakes also, it might, I mean, it will going to rise your BP very soon, even your diabetes mellitus and obesity. That's why my whole motto was, what are the major conditions which are contributing to the heart disease? And they are diabetes mellitus, hypertension, and obesity. Which, I mean, if you see the graph of getting heart disease in 2025, because the recent data I have not seen 2025 or being it 2024, these are the major factors which are contributing to heart diseases, especially in Indian population. That's why I have put. But being thyroid, if you can take thyroid medications on time, it will be fine. So it is not going to contribute much on heart diseases.
I hope your question is answered, sir.
Yeah. Thank you so much. Thank you.
Thank you, Shailesh
Thank you
sir.
for joining us, sir. Excuse me. I'm going to unmute Mr. Shmuel. Shmuel, sir, kindly unmute yourself. Just prompted you to unmute as well.
You hear me now?
Yes, sir. I can hear you.
Thank you very much. Very interesting and insightful presentation. And I want to ask you a question. Is it, according to your opinion, stress and disorders can increase the risk of health diseases?
To rephrase the question for everybody else in the chat room, ma'am, according sir is asking whether he wants to know how stress disorders can affect heart diseases or complicate heart problems, or whether it does or
So, sir's question is how stress is contributing to heart diseases, right?
Yeah.
Okay. Thank you so much for your question, sir. It's a wonderful question which you have asked. So, yes, stress is a normal part of our life, right? I mean, I cannot say that I will not take stress, I will not take stress, because life is such a thing that stress will come. But when it becomes chronic or long term, it can have a significant impact on heart health. So, during periods of stress, the body releases some hormones like adrenaline, cortisol, right? So these hormones can increase the heart rate, can increase the blood pressure, making the heart work more harder. So this happens repeatedly over time, and I mean, if you're taking too much of stress, it can damage your blood vessels, it can also increase the heart disease. So chronic stress can also contribute to unhealthy habits like smoking, overeating, lack of physical activity, and poor sleep. So, the good news is that stress can be managed through healthy lifestyles, right? By doing regular physical exercise, deep breathing, meditation, yoga, getting 7 to 9 hours of quality sleep, pursuing hobbies and relaxation activities, seeking professional help is nowadays a very common thing. If you are having any kind of stress, please go and meet a psychologist or psychiatrist so that they can help you. Don't deal with stress alone. There are people to help you. You are not alone. There are, as I said, there are people in our society who's going to help you out. So if you have stress high, I mean a chronic stress, this can increase the hormones level, which can impair your heart. So this was my answer for your question.
Yeah, thank you very much. And I have another short question. I want to ask you what authorities and the government of India do for reduce risk of health diseases in territory of India.
to rephrase that question for the audience is, ma'am, what according to you are the Indian authorities or the Indian government is doing to reduce the rate of heart diseases or reduce heart issues in India?
Okay, so first and foremost, the government has initiated many policies for heart disease prevention. One most important policy, which I'll say, is about National Program for Prevention and Control of Non-Communicable Disease, commonly known as NPNCD. So this was launched by the Ministry of Health and Family Welfare. The main focus of this policy was to prevent and control non-communicable diseases such as heart disease, stroke, diabetes, and cancer. The next program which our government was has initiated is called as Ayushman Bharat program. Ayushman Bharat program is a very affordable and accessible healthcare through health and wellness center, offering screening for hypertension, diabetes, and other non-communicable disease. And there is Pradhan Mantri Jan Arogya Yojana also provides health insurance coverage for eligible families, including treatment for many cardiovascular conditions. Then for smoking, there is National Tobacco Control Program, which aims to reduce the consumption of smoking, public awareness campaign. tobacco cessation surveys. Then we have Fit India movement. Then we have many hospitals will do public awareness and screening so that they can reduce this non-communicable diseases, sir.
Thank you very much.
Thank you for joining us. Now, moving on to the next question, we have a very regular participant of ours, Mr. Vasant.
Sir, you are on mute. I'm not able to hear you. Please unmute yourself.
Mute. Okay. Am I audible now?
Yes, sir.
Good morning, and thanks to Vishwa. Your one talk was very nice, easily understandable, even to layman. And as an activist, anti-tobacco activist, and convener of anti-tobacco forum from Mysore, I
Very
just
nice.
wanted you laid very good emphasis on giving up tobacco and alcohol. There is nothing good about tobacco. You are right about it. And with regard to alcohol, no doctors agree with each other. Some amount of alcohol is good. That is what they say. And in taking advantage of that, many people are fully taking advantage. And with regard to tobacco, if something is not good for the society, is it not the duty of the policymakers to eliminate that, like polio? Why they are dilly-dallying and why they are using double standards, if I may call it. Because on the one side, they say that we are getting enough money and people are dying every 8 seconds with NCDs directly attributable to different kinds of lung cancer and other NCDs. With all that, knowing fully well that people are dying, why the government is hesitating to stop tobacco? For example, in Guntur also, FCB tobacco is rampantly being cultivated. In Mysore also, they are cultivating. And why this kind of a double standard? That is one question. I'll ask the other question later. This is
Okay.
a matter of policy, okay. But at the same time, the doctors community has got a very strong point in making the government understand that they must eliminate tobacco. They must stop the root cause. That is, they are trying to, as you said, temperance board is there, and then there is the tobacco board, which is helping people to grow more. Tobacco companies are, hello?
Yes,
Can you hear me?
ma'am. I think ma'am has just lost me.
Sorry, I
Just a
was
moment, please.
disconnected from
Can
the
I-
call. I'm really.
Can I
Not a problem.
talk?
Yes, sir. Sorry,
Just a moment, sir. Yes.
Okay. No, there is a lot of disturbance somewhere. Anyway, my question is directly that you people, doctors particularly, must make it a point. That's one thing. The second thing is about, I'll ask it later.
Okay. Sir, according to me, the government of India has introduced several measures to reduce tobacco and alcohol related harm, including health warnings on tobacco packaging, restrictions on tobacco advertising and promotion. If it is shown in, there's a promo which will be come before the movie that how tobacco is leading to cancer, right? Yes,
One
sir.
second. May I, if you don't mind? I've heard this enough times.
Yes,
Okay.
sir. Sir, but yes.
Everything is about demand reduction, not supply reduction. Demand reduction through advertisements, banners, etc. No smoking in public places, taxes to be increased. All these things are only for reducing demand. For example, FCTC of WHO, you must have heard about it. 17 and 18. 17 says alternate crops. 18 says protect environment. Both are being affected badly, and human life is being taken for granted. There is money, no doubt. At the same time, the tobacco companies are building saudas on the dead bodies of tobacco smokers. Is it fair on their part? Is it fair on the part of the government?
No,
Sir, I think you'd have to ask that question to a government official because
Sir, one minute.
overall,
I said,
sir,
I said,
let me,
no.
sir, you already interrupted
No,
ma'am once. Let me interrupt you for once. So, sir, pharma companies give medicines to anybody suffering from tobacco-related ailments, right?
They are giving nicotine patches to prevent
Right.
smoking. That's a bad thing. Instead of that, cut it at the root of it. Stop supplying tobacco crop.
And that would overall reduce the number of lung and heart cases, in turn affecting pharma companies.
Sir, please, I beg to beg your pardon. I'm not here to protect any company or anything like that. I'm only interested
Right.
in
Absolutely not.
Constitution 21 says, notwithstanding anything contained in any of these statutes, your first concern should be protect the health of the people. That means under that you have a right to prevent the deaths, unnecessary deaths. Production is affected. Human beings are losing. Soil is getting depleted. The groundwater is being poisoned. Even the tobacco butts, cigarette butts, are there. They are getting mixed with millions of billions of tobacco cigarette filter bits are lying everywhere. Who is responsible for
Right.
that? Isn't it? That's why I'm saying either you do it or you don't do it. Tobacco is
That's
not
why
at
I
all.
said the question. So that's why I said the question is for a government official rather than a doctor, because
Doctor,
every
doctors
doctor
are
would be against tobacco consumption.
Should
Any
be.
doctor whatsoever
Should
would
be.
be against.
Should be against.
I'm sorry.
Should
And
be
they are.
against.
And they are. And
But
they
that
are.
is-
But that's what asking them this question wouldn't make a difference because they are already against it. You are against it. They are against it. You have to ask the question to the people who are not against it and who are
Then
actually supporting the business model.
Trishant, you get the government people again next time. We will ask these questions
For
to
sure.
them.
I will try my best to get government individuals, sir.
Well, last
Your
question.
second question, please, sir.
Last question. Why two doctors don't agree with each other's diagnosis? I go for second advice, third advice.
Sir, sorry to say that. I think if the investigation and everything is in proper, two doctors will align with the diagnosis which they are making. There might be some differences in the change of medications and change of exercises which they are offering to the patients. Suppose I am giving A medications, the second one might think that no, the composition of this medicine is good, so they might write the next medicine. But there are doctors which are agreeing to medication plus diagnosis. So according to me, it's not like that doctors are not agreeing with their diagnosis.
Why I am saying that is, I went for some diagnosis. I was having some ailment. The doctor said immediately you will have to undergo this particular surgery. And we got scared. What is this? And we went for another consultation. The doctor said, well-known people are, all of them are well-known doctors. And the other doctor said, no, we will try to bring everything under control through proper medication and some exercise. That was the. That's why I am getting this question. Sorry about that.
Thank you, sir.
Okay. Thank you very much. Thank you, Trisha.
Ma'am, I have a friend. Thank you, sir. Thank you for joining us. Ma'am, I have a friend who's a doctor. And I directly asked him about tobacco. And I was like, why is it consumed so much? And he came up with one answer, that it's not good for the body, but it's considered to be the number one stress killer in the current times. And that's why it's propagated so much. And I couldn't challenge anything beyond that because people deal with stress in different ways. All of them have their own ways: yoga, meditation, or eating. Lot of people do binge eating. Now, if you eat too much, I cannot stop the food item you're eating, right? It's like that. If you eat too much potatoes, then you can become obese, but it's not like I'm going to ration your potato supply. So any other commodity is similar. It's like even alcohol, for that matter, is in the same page as tobacco. We all have our opinions about alcohol. We know it's bad for the body. We know in certain minute quantities it could be used medically. But at the same time, people lose control. Once it turns into a habit, the control is lost. So I think, sir, the best way to deal with it is public awareness about self-harm. If you're consuming tobacco, you're doing self-harm. So you have to stop that self-harm. That is what the government has to concentrate on.
Correct.
One second.
Sorry to just interrupt. I feel the major challenge is addiction, as you were saying
Right.
correctly. Nicotine and alcohol causes physical and psychological dependence, making it difficult for many people to quit without professional support. That's why nowadays there is so many professionals who have come for giving support to these people. There are many organizations who are talking about the dependency of nicotine. There are many rehab centers who are taking care of alcohol abuse people. So yes, India is a developing country, right? We as in healthcare professionals are taking huge steps, I'll say initiatives, to aware every people how bad it is, how what are the harmful effects smoking on nicotine or alcohol is going to do in your body. As an healthcare professional, I am seeing patients every day, and as an individual, as a citizen of India, I can say that I am doing my part. I am doing public awareness. This platform itself, we are spreading an awareness about cessation of smoking, stoppage of alcohol. So as an Indian, as a citizen of Indian, we are doing our part, and we have to continue this.
May I, if you don't mind? Last.
Yes, please.
Please, sir.
Even I'm doing a bit of mine, and in YouTube, you can just how I gave up smoking in 8 hours. There is a 14 minutes YouTube. How it is possible to develop willpower. You can mark my name, Vasant Kumar Mysore Mutt.
Sure,
And
sir.
then
Right, sir.
Vasant Kumar Mysore Mutt. In YouTube, it's a 14-minute experimental thing. I have succeeded in doing that, and I have made it in one of the cancer hospitals. It is a small item that will be made. Weekend programs. How it is possible through this kind of a thing. And from mob, I've asked somebody who is interested in giving up smoking, come to a particular place, bring only one cigarette and one matchstick. This starts the story. And by evening 5 o'clock, that cigarette will be there, matchstick also will be there. How it is done is the important thing. Willpower. If you don't have, you cannot
Right.
expect government to do that. They are playing double games. That's all we know. Thank you.
People are the government, sir. Thank you for joining us.
You agree.
Ma'am, I'm going to bring up the next question. I'm going to move on to the chat box. There's a question from Mr. Eskumar. He wants to know protein sources for vegetarians.
Okay. Sir, protein sources for vegetarian will be curd. Curd has good amount of what do we call it as?
Lactobacilli.
Yeah, no. There's one terminology. I'm forgetting that. So it is very good to have curd. Then you can go with the, if I can say, for vegetarians, protein sources. Mm, curd is one, milk is one.
Soya.
Soya oil is very good. Soya bean is very good. If you are not taking egg, then okay, vegetarians, soya, then milk, curd. Then I can say there are many vegetables also which are good sources of protein. Let me just have a quick run, because if somebody can ask.
Ma'am,
Okay.
I
Sorry.
think the protein,
So
I just checked out
I
the
can say
protein
that,
name in
yeah,
curd.
chickpeas is a good thing. Rajma is very good, which is plant-based protein. Then black grams, then green grams, which is also called as moong dal. Then soya bean, as you said, tofu is again a very good product which we can vegetarians people can consume. Then flax seeds, chia seeds, pumpkin seeds, sunflower seeds. I guess these are good plant-based proteins. If I say that if you want to give me more, then dal is also a good source of protein, lentils. So I guess these are some good plant-based protein sources for vegetarian people.
Thank you, ma'am. I just checked up the protein uh, name in curd and on Google, and it's got casein, and it makes up 80% of its protein content, and the remaining 20% is
Yeah.
whey protein.
Yes, correct. The name was not coming in mind. Thank you so much.
I was not aware. Thank you for bringing it up.
Yeah.
And, okay. There's a question from a guest. How much physical exercise is too much? Why do people, why are people dying while working out in gym with sudden heart attacks these days?
Correct. A very good question. I'll say that. So, regular exercise is one of the best ways to protect your heart. So, as I said, 150 minutes of moderate intensity exercise per week, such as brisk walking, cycling, swimming, can be done. If you're an adult and if you want to do a vigorous high intensity exercise, then you can do it for 75 to 150 minutes of day. And in addition, strength training at least 2 days per week is recommended. But this is a general exercise or physical activity which I'm conveying right now, but it requires a detailed assessment of an individual to tell me how much physical exercise needs to be done by that individual. Now, during this exercise, there are some warning signs that an individual can face, like chest pain, tightness, unusual shortness of breath, dizziness, fainting, palpitations. Like if they are walking, they'll feel that, oh, I am having breathlessness just by walking 10 meters. I'm just giving an example. So there's a requirement of checking it properly, assessing the patient properly, so that we can prescribe the good exercises. The next question was, why are some people dying of sudden heart attacks in the gym? Yes, news reports of sudden deaths during workouts can be alarming, but it's important to understand that exercise itself is generally beneficial and reduces the long term risk of heart diseases. Now, possible reasons can include, they might have undiagnosed coronary artery disease, where narrowed arteries reduces the blood flow. There can be inherent heart conditions such as hypertrophic cardiomyopathy or certain electrical disorders, especially in younger individuals. There can be poorly controlled risk factors like high blood pressure, high sugar, cholesterol, smoking, diabetes. Suppose a third reason can be they are exercises continuously without doing proper conditioning, particularly after being sedentary. They're just lifting weight because a gym trainer has told. They're taking way too much of protein, which is again bad for the body. They are not taking electrolytes properly, which can damage or which can cause electrolyte imbalances. They are dehydrated mostly. So in some cases, again, in some cases, this can be the possible risks of getting cardiac arrests in young individuals, especially whenever they are exercising. Because if you have seen that gym people, they're taking too much of unusual protein, which is not good for the body. They're lifting weights, but do they know if this weight is good for their body or not? No, not an idea. So yes, it is important to note that every sudden death in a gym is due to heart attack, right? Yes, I mean, but it is also very important to understand that not every dying in gym is can be caused by heart attack. It can be due to some serious heart disturbances like arrhythmia or other medical conditions. So a medical evaluation is often required to determine the exact cause of that individual.
Thank you, ma'am. There's another question from the same guest. At what age should people start getting regular heart health checkups?
After 40.
After 50?
After 40. Nowadays, after 40
40.
years of,
Okay.
everybody should go ahead, because of the sedentary lifestyle and the food habits which we are taking. It is very much required to have a regular checkups.
Do processed foods play a role in increasing
Yes,
heart
yes, a
disease
lot,
risk?
a lot, a lot. That's why if you see any
I
episodes
wanted
of
to.
Shark Tank, sorry to interrupt. If you see any episodes of Shark
That's all.
Tank, sorry to take that name. I'm not very sure, but the sharks are very much focused on about the diet. If there's any food company which is coming, they're very particular. How much is protein? How much is carbs? What is this? What is the shelf life? So they're very particular. So these are the awareness which people are doing actually in a public forum. So I think there is an awareness, people are knowing about it. It's just we have to follow it also.
Right. Ma'am, I have a question. So heart is a muscle, right?
Yes.
So uh, is is a heart healthy when it's say flexible and say tender, or is it healthier when it's tighter and stiffer?
No, flexible is always better, because if the heart vessels
Right.
or if the arteries gets narrowed down, if it becomes stiff, then the blood flow to the heart is not going to happen, which is very bad.
Right, ma'am. So, ma'am, can gymming too much turn your heart stiffer?
I'll not say that it will become very stiff, because research is not being done too much. But if the individual is following a proper guideline for exercises, then yes, they can. But if they're not following a proper guidelines for gymming and they're not doing proper strength and conditioning, then it might affect them.
Thank you so much. A question from another guest. Are the symptoms of heart disease different in women compared to men? If yes, what should women be especially aware of?
Okay. See, the symptoms are not different much, but in women there is one problem. I'll not say it's a problem; it's a natural phenomenon. It's not a problem though, but it's a natural phenomenon which a woman goes into after her 50s, 45 plus, also menopause. Right. So now menopause is being considered as perimenopause, menopause, and postmenopause also. So menopause causes many hormonal issues in the body. So there might be some chances that a woman might have a different sign and symptom, but there is no bifurcation given for different sign and symptoms compared to men and women. Sign and symptoms being the same.
Thank you, ma'am. A question from another guest. I think this is the last one in the chat box. I request all the participants still in the room to. Okay, they have it. We're having more questions coming in. Has COVID vaccine affected, or does it have side effects of heart attack? As long as a lot of young people are dying because of heart attack. So did the COVID vaccine play a role in it, or by any chance?
Yeah, I was expecting this question, because whenever I say this, whenever I go, whenever I deliver a speech about this topic, this question comes in, because in Facebook and Instagram there were so many people talking about this, but there is no credible evidence stating that COVID-19 vaccines are causing widespread increase in heart attacks among young people. The vaccines has been given to billions of people worldwide, and extensive monitoring by health authorities such as WHO, CDC, and national regulatory agencies have shown that they are highly effective at preventing severe COVID 19. But there are, however, rare heart related side effects which can be shown, like inflammation of the heart muscle, myocarditis, or this cases are very rare, I'll say that. Very rare. And if they are having myocarditis, which is inflammation of the heart, it is different from a heart attack, importantly. Myocarditis or pericarditis, which is inflammation of the lining around the heart. These are two medical terminologies, myocarditis and pericarditis. These are actually different. So heart attack usually occurs because the blood flow to the heart is blocked by a clot or the narrowing of the coronary arteries, whereas myocarditis is the inflammation of the heart muscles, not the complete heart. And pericarditis is the inflammation of the linings around the heart. So it is also important, I mean, it is important to remember that COVID-19 infection itself increases the risk of heart complication. If any individual had COVID-19, that automatically they are at a risk of getting heart attack. including myocarditis, blood clots, heart attack, and strokes. Studies have constantly shown that the risk of heart problems from COVID-19 infection is higher than the risk of or the risk from vaccination. So it's absolutely, research has not shown that if after getting COVID-19 you will be at a risk of getting heart attack. It's not sure shot, but yes, there are rare chances that people might get some inflammation of the heart. That I can say.
And the vaccine could maybe, along with other
Yeah,
morbidities, could
it's correct.
give
It
more
might
blood
get,
clots or something.
yes, it will give you the other complications, but it's not about the vaccines because WHO, CDCs, everybody has checked and it has been given to so many people. If that was the case, many people would have died till now. And India's population is very high.
A question from another guest. Can stress alone lead to heart disease even if someone has no other medical conditions?
Um, I'll not say that stress a 50-50 or not 70-30. I can say that stress is a very important or integral part of our life. I'll not say as an individual you will not have stress. I cannot say that because in life there will be ups and downs. You cannot lead a happier life every day. You cannot, I mean, how much ever I pray, please, day should be good. I mean, we wish people have a good day ahead, whatever we say that, but there will be some incidents which can aggravate your stress. So there are two types of stress: positive stress and negative stress. I mean, stressors, which we call as. Try to understand about stress management, try to understand what are the causes of stress and try to eliminate them from your life. Because I cannot say that please don't take stress. I mean, if you're taking stress, also try to eliminate that you from your life so that you can lead a happier life. And if you're getting stress, you will automatically get high BP. You will automatically, I mean, not in 1 day or 2 day, but for a longer run, yes, you will get high BP, which is again a precursor of cardiac arrest.
Thank you, ma'am. Then the last question in the chat box. What's the biggest myth about heart disease that you'd like everyone to stop believing?
Okay, so the first myth, which I have already spoken, that heart conditions can happen only at old age. It cannot happen in young adults because nowadays everybody is seeing that cardiac arrest is happening in young individuals also because of many other, many other problems like sedentary lifestyle, their diet, and all that. And next question is, there was a myth which I have come across that heart disease can affect only men or women because of so and so reasons. Yes, the incidence is higher than in men, but it can affect both men and women, which we are seeing it. I mean, which we are seeing that increasing rate, especially because of the problems which I have told you. Another dangerous myth is, if I don't have chest pain, my heart is fine. They have that, oh, I am not getting any pain, I am fine. But you don't know the blockage is happening, and suddenly one day you will be unconscious and they have to rush that patient to the hospital, right? And last but not the least, a third myth which I want to share is, I am fit, I go to gym every day, I cannot have heart conditions at all. Whenever or while doing regular exercise, I mean, very good exercise is excellent for health, but it doesn't completely eliminate the risk of conditions like high cholesterol, inherent heart diseases, undiagnosed coronary artery disease. It can still be present in your body. That's why regular health checkups are very important, especially if you have a high risk factor or a family history of heart disease. So this will be the myths which I want to clear from my presentation and from my session.
Thank you so much, ma'am. Thank you so much for your time and patience.
Yes.
And for anybody who's missed any part of this session or would like to go through this session again, I'm pasting the link of this particular uh, session in the chat box. You can share it with your friends and peers and family and kindly share a word about this session and help everyone out everybody who is paranoid about heart problems, kindly send this to them. With that, I'd like to announce the closure of this session. And ma'am, if you'd like to say anything to the rest of the people in the chat box.
I just want to say that please do exercise, please visit physiotherapists, please visit cardiologists if you're facing any kind. I mean, a small sign and symptom can also uh, can lead a very dangerous thing in your life. So please, if you are facing any small sign and symptom also which is not usual, which is very unusual, you had one day, or you are not having every day, sorry, you're not having it every day, and suddenly one day you're having this sign and symptom, don't think that you will be fine if you just take rest. Don't think in that manner. Please visit a doctor, please visit a physiotherapist, so that we can help you out. There are tremendous advancements which has happened in healthcare technology. We can help in diagnosis, we can help in preventing it.
Thank you so much, ma'am. And
Thank
you'll
you.
see a breakout room link shortly on your screen. Kindly join into that, and I'll be there with you shortly.
Sorry, I didn't get you.
You'll see a breakout room link on your screen shortly. Kindly join into that, and
Okay.
I'll be there with you in a second.
Okay. Yes. Thank you.
Thank you, ma'am. Thanks to everybody who's still in the chat room. Thank you so much for joining us. Your presence and participation motivates us to do better and bring in better topics. You can always write to us through the website customer support and suggest topics to us, suggest better, renowned speakers to us and with links, and we will try to bring them up for a session. And thank you for joining us. Hope to see you again next